So next we have Dr. Rahul Batra, who works at Guy's and St Thomas's NHS Foundation Trust, absolutely fantastic trust, up the road from us actually, up the road from me. And he's going to speak about the future of diagnostic testing. It's digital, rapid, and at the point of care. Thank you.
Hi, everybody. Thank you for having me. My name is Rahul Batra, and I am the Deputy Director of the Center for Clinical Infection and Diagnostics Research at Guy's and St Thomas's Hospital. So what I wanted to talk to you today about was the impact that we've seen of COVID on the digitalization of the NHS and how that plays into the renewed vision of the long-term plan. So the long-term plan, when it came out in 2019, it did have very strong digital basis. Some of the targets that were discussed in the original long-term plan were things like a digital-first approach to primary care, and that was offering patients a digital appointment rather than a face-to-face appointment. To develop the NHS app so that patients can communicate with their physicians, report results, and get reports back. And also to develop the NHS 111 service so it fitted into the patient journey and rather than being just an informational service. And then COVID hit. And the expectation was that the long-term plan would be put aside. But what we actually saw was an acceleration of the backbone of digitalization in the NHS. So some of the red tape that comes with bringing in digital solutions in the NHS was put aside. We quickly went to from 3% of GP appointments being online to over 75%. We all used the NHS app. We all downloaded it, reported results through it, and we also started using 111 to direct care. So I wanted to talk a little bit about our experience with our partners, TestCard and SureScreen, about how we developed digital solutions during COVID. So I'm going to give you a brief background on Guy's and St. Thomas's. So during the pandemic, almost everybody in the NHS during the first wave felt that they had a personal connection with what they were doing within their work streams and their trusts. And we felt the same way, especially since we're just across the river from the Houses of Parliament. We felt like we were front and center to the COVID pandemic. We're a very large tertiary teaching hospital. We have a very large ICU. We also have the second largest ECMO center in the UK, and that's, some of you might have become familiar with ECMO during the pandemic. That's where patients who have failed ventilator therapy have their blood oxygenated outside of their bodies. And we are also the lead high consequences infectious diseases center, one of 7 that were developed after the Ebola outbreaks and the SARS outbreak. And this was for UK preparedness for airborne pandemics. So we had just finished developing these centers in 2018. We were first activated in November of 2019, just prior to the pandemic, for the first monkeypox outbreak in Europe. So we were already kind of ramped up and ready to go when COVID came along. We also have a translational diagnostics research center that focuses just on infection rapid diagnostics. And so all of these came together to really play a part in how we developed new testing modalities during the pandemic. So what did we see? Very, very early on in the pandemic, in late February, early March, when we received our first patient, which was the second patient in the UK, we found that the UK would not be able to cope with the amount of testing that was going to be required, even just in the inpatient setting. And so that was the pillar 1 testing you can see there. And that's your basic molecular tests, so your PCR tests. And you can see April 2020, there was a ramp up, but it pretty much tailed off. Now, we noticed that very quickly, and we also noticed that there was massive supply chain problems, and that in order to overcome this for our patients, that we were going to have to do something different. And so we looked around, and what we found was that we thought that lateral flow testing would be the optimum way of providing mass testing to not only our inpatients, but our outpatients. And so we went on a journey to find clinical partners and commercial partners to help us develop lateral flow testing for our hospital. And by May of 2020, we had an antigen testing program, or antibody testing program in place. And by December of 2020, we had a full antigen testing program in place. So in December 2020, if you remember, there was the second wave, or the alpha wave, that started, and that, basically changed our whole perspective of what was going to happen long term with COVID. We thought we had a break in the summertime, and we were going to move forward with the vaccine, and then the alpha wave and the Kent variant came along, and all of a sudden we were overwhelmed again. But for us, luckily, at this time we had already developed our lateral flow testing, and we implemented it in A&E, and were able to put into place a universal testing protocol using lateral flow. But we immediately noticed that we had some problems with that. Lateral flow is an analog test. It's not used very much in hospitals, and there's a couple of reasons for that. One of it, it's very hard to record results. As we move to more of a digital NHS, recording paper results or manual results is very difficult, and so lateral flow gets put to the side. And so what we did during this time is we actually used our current glucometers that were everywhere in the hospital to manually enter the lateral flow results. And that was an okay workaround for the time. But we found that very few people wanted to enter the amount of information that was required. You had to enter the expiry date of the test, the lot number of the test, and then the result. And anytime you do manual entry, there's lots of areas where you're prone for manual entry errors, and that's what we saw when we started to use this workaround that we had created to get the results into the patient record. And so at that time, we partnered with a company called TestCard, who had a digital solution in the market already for UTIs, in order to develop, to make our lateral flows digital. So with the ClearScreen solution, we worked closely with them to make a workflow that would support the use of our lateral flow in A&E. And so what it did basically was turn any phone into a clinical scanner that would scan the test. With the single scan, it would pick up the lot number, the expiry date, and suggest the result to the healthcare worker. And at that point, the healthcare worker could accept that result or override that result and put in the result that they wanted. And this was done in one single scan. And immediately the record was available the result was available to all clinicians in the patient record. And so this was revolutionary for what we had required our testing protocols to do, because all of a sudden now we're able to offer universal testing in A&E with a digital result that was available in the patient record immediately. So we built a test flow around this. So all throughout the hospital, it was the same test flow. You scanned your user ID, you scanned the patient ID that were already available, and then you scanned the test. The information would go to a web portal where you could review the actual physical scans if you needed to, but more importantly, the test result would go directly into the patient record. And this was taking a very analog test that was fast and cheap and making it into a digital solution that allowed us to immediately put universal testing in throughout our whole estate at a very, very low infrastructure charge and infrastructure work. So just to show you what the reader does actually, so we have a whole test library that we have so we can add tests whenever we want. It gives you some scanning tips. It has a timer for the test that you can skip if you need to. And then you just line up the test, you scan it, and then it provides you the result. And you can override that result if you need to, and then that result goes directly into the patient record. And what's powerful about this too is that not only is this result going to the patient record, if there's any questions about the result, if we ever need to review it, we have the actual physical scan in a web portal for us to review. And if there's any questions or positives or anything that we need, these results are immediately, alerts can be transmitted to your infection control teams, to your site nurse practitioners, and can assist in bed flow and patient management. So this is the basic patient flow that we made, and this allowed us to then use the test throughout the hospital and then to further develop the tests for outpatient needs and for the needs of our visitors also. So what did this solution do for us? So what we actually found was that we were able to reduce overcrowding in ED and to reduce the need for side rooms because we had universal testing at the front door within 10 minutes, and we were able to act upon those results. We increased our testing from about 30% in A&E to over 95% and increased the recording of these results so that you didn't have to do repeat testing as a patient moved around the hospital from 15 to 98%. We also fulfilled all of our statutory requirements by increasing the reporting of statutory information to almost universal. And we decreased the manual input errors that we're seeing to less than 2%. So now where are we? So in 2020, we launched universal COVID testing. By 2021, the solution was well embedded within our hospital, and we launched a dual COVID and flu test. And we ran that through the 2021 winter season. And then we repeated that now as the final solution for 2022. Moving forward, we're further embedding the solution by looking outside of infectious diseases. So as our hospital moves towards EPIC as our EPR of choice, which is a totally paperless system, there are tests that were done in A&E and other places in the hospital that were typically recorded on paper. A lot of these would be like your standard urine dip pregnancy test. It gets done, it gets written, scribbled on a piece of paper in A&E, stuck on a file, and then probably repeated somewhere down the line when you needed imaging or something else. So what we've done is developed a digital solution using the same reader, the same test, where you can do pregnancy. It gets recorded immediately in the patient records in the correct area, so it doesn't have to be repeated down the line. And using lateral flow, we can also quickly pivot our testing to new infectious disease threats. So we developed a strep A test when there was a strep A outbreak earlier in the year, and we also developed a monkeypox test last year when there was the monkeypox outbreak. And because this solution is so portable, we can put it anywhere in our estate, which is quite large. It's 4 hospitals now. In our outpatient clinics, we can give this solution to our link nurses, and we can also give it to our patients to download at home. And all their information is transmitted back to the patient record without any personal identifying information being recorded or transmitted. So how does all of this fit into the renewed vision of the long-term plan? So the long-term plan is about offering digital, in terms of digitalization, is offering digital solutions to our patients and to our staff. And how do we use these digital solutions to improve healthcare delivery and democratization of testing? Okay, so what do I mean by that? So these tests are so easy to use and fit into your clinical pathways that they can be done by pharmacists, they can be done by site nurse practitioners, and they can be done by patients. So all of a sudden you can develop pathways using these digital tests that bring your patients into their own care. And that's really important in making patients aware of their own situation and how they manage their own care. So what we're hoping to do is further develop this testing modality so that we can offer it not only in the inpatient setting, in the outpatient setting, but also in chronic health settings. So we're hoping that this fits well into the long-term plan, and we will continue to work with our partners, TestCard and SureScreen, and also with NHS England to offer these solutions to a wider audience. Thank you very much.